Guys, it's in the middle of a work day, you know. You're not gonna make us drink beer. Elaine, you know who the producers are. You know who's making us drink in the middle of a work day, okay? Hello and welcome to another episode of My Grandma Also Know, where we ask specialist doctors everyday medical questions and misconceptions for you so that you can flex to your friends. Huh? You don't know what? My Grandma Also Know. I'm your host, Mabel, and today we have consultant urologist from Aare Urocare, Dr. Fiona Wu. Dr. Fiona, today you see the producers have prepared some of this in front of us. I have no idea what they're up to, but
sure.
I'm up for it.
Of course.
So Dr. Fiona, share a little bit more about yourself. As a urologist, what are the kind of conditions that you see?
Hi, I'm Fiona. I'm a urologist and I also happen to be a female. That's not very common already. Most urologists can see many different conditions. It's just that my subspecialty is female urology, whereby I see most of the incontinent cases. I see voiding problems, i.e. peeing problems. I also see mostly females with urinary tract infections.
So now that we have understood more about you, we'll move on to the questions.
Yeah, before that, we have a challenge for Dr. Fiona.
Again,
In every episode, we have a challenge for our doctors. For this episode, we've got beer pong with a twist. Dr. Fiona Wu will have to answer our questions in no more than 30 seconds. If she fails, she will be challenged by Mabel to throw a ping pong at a set of cup with secret ingredients. The secret ingredients we prepared are either good or bad for bladder health. Dr. Fiona will have to explain why and how this affects our urinary health. And at the end of the round, both contestants will have to drink the cocktail they've created. Let the challenge begin.
Dr. Fiona drink only, right? Not me, right?
No, I think coach should drink, right?
Kena sabo. First question, where does the fluid to our kidneys come from? I don't know if this is a very stupid question because if we talk about like anatomy, right, we know where poop comes from.
Yeah.
Food goes in, esophagus, stomach, intestine, rectum, out. But where do pee come from?
The pee starts being produced in the kidneys because when we drink water, it gets absorbed by the intestine. That's one way. Another way is that when our bodies process energy and other kind of metabolic stuff, water is also produced. This is where our urine comes from. So they'll all finally go to the kidneys. The kidney will do its own work. It detoxifies, it takes away the waste, then after that it all comes.
First question. So Dr. Fiona, first question, then we have to do for fit already.
Yes.
Yeah. So usually only the doctor drink, no? But this time around, the host also need to drink.
And you're okay?
Drink for the way.
Penny, I can't take it.
Can. You're sporty. Volleyball. See?
Blue colour good for bladder eh.
Oh,
Is it good for bladder?
particularly not really, but it's very good for health.
So guys, this is wrong Agu is wrong. Google is wrong. Sorry. Ew. Yay!
Ew, it's celery juice.
Oh my god! Who is that? Okay, celery ginger juice good for the bladder.
Again, it's good for health. You drink it lah if you like the taste.
So next, we hear this all the time. Incontinence. What exactly is incontinence?
So urinary incontinence is a situation whereby the urine comes out without the person peeing. It's basically a leakage of urine. Depending on the situation, it can be stress incontinence, meaning that there's an increase in abdominal pressure. For example, you sneeze and cough or you jump, then the urine leaks out. Or urge incontinence, when you feel urgency, the bladder contracts a bit and the urine comes out on its own, or mixed picture.
So next,
Wait. I think it will be more fun if we add on one more challenge. How about Dr. Wu answer this next question fully in your dialect? What dialect do you speak?
I can speak Hokkien.
Okay.
You know, can understand Hokkien, right?
lucky
understand?
I understand 80%.
If I cannot find the word, can I just use Chinese?
Cannot.
Oh, so
Cannot, Chinese.
So is it true that urinary incontinence comes with menopause? Imagine I'm the ama over here now. Correct.
查某收经，迄阵较侪人是淡薄老石，因为咱的石大无安尼有力了，所以淡薄激着伊就流出来。咱的 muscle 肌肉无安尼有力，生囝过了迄兜的咱的下身的迄个肉无安尼有力咯，所以吼也是咱淡薄拍甲手，甲是加手，石就会流出来。咱愈流会愈普通。
Oops.
Got something I want to say.
Oh yeah!
April Maple, come and see. Your favorite. Beer.
Beer, guys, it's in the middle of a work day, you know. You're
Oh.
gonna make us drink beer.
Oh
Yeah, can lah.
Chocolate.
Is chocolate drink bad for the bladder?
I think right, if it's caffeinated chocolate, right, then yes. If it's just pure chocolate like Milo, you know, I don't think it makes a difference.
All this information from Google, very wrong. Is holding in your pee bad?
I would say to a certain extent, yes, holding on your pee for extended period of time is bad. You expand your bladder to such an extent that it cannot contract properly after that. So as time goes by, when we age, the bladder already loses its elasticity a bit. And by overstretching it, right, it causes it to be a bit floppy. So at the end of the day, when you get older, you cannot finish passing urine. You need to pee at the appropriate interval.
This one, right, is something that I personally actually experience a lot. I don't know if everyone else also. Why do we pee more when the weather is cold?
This is a very common question. We pee more when the weather is cold because when we sweat less, so the body water, right, has to go out somewhere lah. So it usually ends up in the pee.
Makes sense.
When we breathe faster in hot weather, right, all our respiration, all this contain water also. So we tend to pee less.
How much protein is too much protein until it becomes harmful for the kidney?
Okay, as a ballpark figure, right, if you take enough protein per meal, right, for example, you eat a piece of fish or a bit of chicken for every meal, I think that's adequate already because for most young men, that will be quite good. To take protein tablet, right, is already excessive. Unless you tell me you totally don't take protein.
Protein powder?
For example, protein powder lah. So like vegetarian, they totally don't take protein or they take gluten or whatever, right? Then you can take a bit of protein powder. But if you take enough meat already, or some people they go gym, they take a lot of like chicken, right? Then right, there's no need to take protein powder. This is hard. Yeah.
Oh.
Cranberry juice. Sian. I want chocolate.
Hey, what in?
Honey. Honey good for bladder health.
Honey is just good for health. From what I know, I don't think it's very good for bladder.
Why do certain beverages like coffee make you pee more?
Okay, certain beverages like coffee, they irritate the bladder, so you feel the urge to go. They also have a bit of diuretic effect. That means they work the kidney so that they, got more urine produced. Alcohol as well. So that's why when people get drunk, all this, we tell them drink a lot of water because they're dehydrated.
No, cannot relate. Okay, I should find where's the beer.
It's okay.
So understanding our pee, how frequently and how much should a healthy person pee?
Usually, right, I would advise people to pee every 2-3 hours if they drink adequate amount of water. As a ballpark figure, I tell patients, right, you drink about 1.5 to 2 liters over the whole day. Then you pee every 2 to 3 hours. So in all, right, anytime less than 7 times per day is quite normal. If you pee more than once a night, it's not so good.
So you drink 1.5 to 2 liters of water. Does it mean that you pee out 2 liters of water also?
So when patients do the bladder diary for me, they are very puzzled. No, it's not equal. It won't be equal. You sweat, then you're breathing on the insensible loss, so it will never be equal.
Speaking of urinating at night, right? Why do the older folks pee more frequently at night?
Can you answer this in Hokkien?
Okay lah.
Again,
老人暗暝會放較濟少，因為因人嘅身軀嘅荷爾蒙無安尼好了，所以暗暝會少變濟。少年迄陣較袂，因為少年迄陣咱嘅荷爾蒙正常啦，所以早起會放較濟少，暗暝無少咯。
because of hormones lah.
Yeah.
Hokkien pass. At the end of the day, right, what are the few treatment options for someone with urinary incontinence?
First of all, right, we have to diagnose properly and see what kind of incontinence they have. Stress incontinence, you can either do pelvic floor exercise or you will do a surgery or non-invasive procedures like recently we have laser treatment. Laser treatment, which is kind of photonar laser, it modifies the tissue, it makes it thicker, but this is a temporizing measure because as we age, we leak some more, then we go for surgery, whereby we lift up the urethra, sort of kinking it so that we don't leak so badly. For urge incontinence is easy. Okay, again, pelvic floor exercise, take a bit of medication, and only if the medications don't work, we move on to the third line, like percutaneous tibial nerve stimulation and Botox injection for those very bad cases.
I thought Botox or frown lines.
It's the same medication that we inject into the bladder to calm it down.
Not only for your frown lines, but for your
Botox is very
bladder.
useful. It can also be used for spasms in other parts of the body.
Now that we've covered urinary incontinence, let's move on to something very common as well. UTI. Are women more prone to UTI?
Yes, to a certain extent, yes, females are more prone to UTI. For males, right, the urethra is very much longer and it's further away from the rectum. So it's not so easy for bacteria to move from the rectum up to the urethra. For females, right, it's all quite close together. That's why we have it. Some people, they get UTI when they have intercourse because there's some mindful trauma during intercourse. And then we don't drink enough water. Females also sometimes hold back their urine. And then we reach menopause too. There's no way you can finish.
What?
Cold. Yay, people have a cold.
Already got cold.
Is Coke bad for bladder?
Yes, because it contains quite a high amount of caffeine.
Mm.
Red Bull also. So
Google is finally right about one thing.
those that are bad are probably correct. The good ones are basically just good for health.
Yay! Honey again. Okay lah.
Okay lah.
Lucky you lor. So just now we talked about intercourse, right? Why is it that women are encouraged to pee after intercourse?
But right, it's a bit controversial.
Oh.
Okay, some studies show that it helps, some studies show that it doesn't help. What we're trying to avoid is having a full bladder after that, right? That the bacteria can go in. But for some people who don't usually get infection, I don't think it makes a difference.
Then masturbation.
For females or for male? I think for females,
Females.
I don't think females get infection when they masturbate. 就是
No lah, it's okay lah that one.
可是我都没有讲。
For UTI, right? Are there any home remedies? Because you go Google search, right? A lot of them suggest drinking cranberry juice.
So basically, we tell patients to drink a lot of water. Okay, I think that's the most important thing. If you have no money or whatsoever, right, get UTI, please drink water. Okay, it's cheap. You get from the tap.
No money for cranberry juice.
So the cranberry juice one, the large scale studies, right, show that it doesn't really help, surprisingly.
Something quite funny that we've heard before. Will swimming in a public pool cause UTI?
I don't think so, because when our body has a way of closing up, the vagina is actually open to the environment. Our mouth to our anus is open to the environment.
Yeah.
So the vagina also. But even if water gets in there, it doesn't really cause UTI. Because our body have a way of eliminating bacteria, you see. So if you're swimming, right, it's very hard for the bacteria to swim in the chlorinated water to get up to the urethra and to the bladder. It's very hard.
So what is the best treatment for UTI?
I personally think that the best treatment is prevention. Drink a lot of water, go toilet regularly, and then don't hold your bladder unnecessarily. I think that's the best kind of treatment we have. If we really have it, really no choice, then we have to get it treated. If it's sexual intercourse related, right, then sometimes I will ask the younger patients to take one tablet of low-dose antibiotic after intercourse. But long term, I think it's a bit difficult for most people. For menopausal females, right, I will give them topical estrogen, so it makes the private area less dry, so they're not so prone to it.
Wow, so true.
Just nice.
Just nice.
Understand that andrology is also a part of urology. Be more interesting sex talk. Are blue balls a thing? And is it dangerous?
You know that there's a blue ball cafe at Pasir Panjang? There's something new, right? So is blue balls a real thing? I think the guys will say yes, Sometimes they say that it's because they didn't release the semen or this, so they call it blue balls. But I don't think it's true. I never see in my life lah. It's still blue.
So speaking of blue balls, will not having sex lead to prostate cancer? Is this something you heard before?
Yes, of course. People will ask me that. But it doesn't make sense. I always tell them, uncle, in the end, all the monks, right, will get prostate cancer. It doesn't happen. I don't see a particular group of people coming and they got prostate cancer. No. Maybe they don't check, I don't know. But the fact of the matter, it doesn't. Prostate cancer happens when we are old. As the male ages, the risk get higher. These very old studies, right, they did cadaveric studies. Those people who pass away. By the time you hit 80, right, a lot of men will have big prostate. And quite a lot of men will have prostate cancer. Prostate cancer didn't disturb them in their lifetime because these people pass away from other kind of conditions.
Times. Wow.
Again, I find easier to throw that.
Oh, where?
Chocolate! Can lah.
Can lah.
Okay? Can lah.
No.
Do again.
Oh, my face!
Try.
Yay!
Oh,
My
yeah.
favourite, but bad for bladder.
So it is bad for bladder. What are some of the daily habits that may affect a man's fertility? For example, right, we have heard before, men shouldn't put laptop on their lap because kills sperm. Or eating mint.
I know that going to the sauna, all this makes it worse. Heat.
Oh,
There's a good reason why the testes is outside the body. If I don't remember wrongly, it's 2 to 3 degrees lower than our body temperature. It's the optimal temperature for sperm.
it needs to be cold.
It needs to be cool lah, not cold lah. So when you do things like go immerse yourself in sauna or spa or whatever, right? Then you are just killing your sperm more. So we don't recommend people go to the onsen if they want to have children. But of course, we need to test the semen analysis lah. We need to see whether the quality okay. If the quality is okay, you can go to the onsen. There's no issues.
So it's a cheap vasectomy.
No, but you don't go and burn your balls on purpose, right? And I don't suggest people put laptop or what. It's just very uncomfortable.
Yeah, you want to tell our boyfriend. Hey, no need go vasectomy. Put a
Burn your
laptop there
balls.
already.
Okay, right?
Can you get water?
Not bad, you know.
Thank you for being such a good sport. Okay, she'll find where's the beer.
It's okay. Let's
show
put
the
some
cup.
honey.
Yeah.
Then might put some honey 可以了。
I think that today, apart from the blue balls talk, we learned quite a bit about the common women's health conditions. And although they are very common, it doesn't mean that we need to live with it, and it's actually very treatable under the right care.
Yes,
Yeah.
I totally agree.
Thank you for watching My Grandma Also Know. If you have any medical questions, be it in the field of urology or any other medical specialties, let us know in the comment box below. And if you enjoy watching this video, please like, share and subscribe, and we'll see you in the next episode. Bye!
Bye.